Hey there, everyone. Dr. Tharp here. And as usual, I say I am on a mission to help those people who really want to reverse type 2 diabetes naturally. I help to empower you to reverse it. I am here every night to give you a few tips that might help you in your journey, might help you to realize that it is possible. And that's why I'm here tonight. And as you can see tonight, I am in my scrubs. So today was one of my hospital days. And it's one of the main reasons I do this because I still round as a hospitalist as well as I have my practice that is focused on empowering people to reverse type 2 diabetes naturally. But the reason I do this is because when I started my career in hospital medicine, I saw the incredible and horrendous complications that happen as a result of type 2 diabetes. I have seen people who felt like life was going fine, everything was good, and then out of nowhere comes the devastation, comes the stroke, comes the loss of a limb, comes, I see people every day who struggle with the bothersome neuropathy. For those of you who are struggling with neuropathy, you completely understand what I'm talking about. And so that is why I'm here tonight, is because I want to help you avoid that fate. And so, of course, I want you to feel like, action, to take action. I want to inspire you to take action because one of the biggest issues that has happened in healthcare in general, in traditional healthcare, is that that guidance to reverse the numbers naturally is gone. The focus is on prescribing medications. The focus is on managing illness and not necessarily on empowering you to reverse type 2 diabetes. And ultimately, what tends to happen there is you develop a sense of helplessness. You develop this sense of feeling alone. And as a result, you get with the program of just managing. But when you manage and you don't know exactly what to do, how to eat, how to move your body, you don't know the day-to-day habits that you should be incorporating, then what happens is one med turns into a second, turns to a third, because the medications are band-aids, right? The medications are what just keep the blood sugars down temporarily. And if you're not getting to that root cause and you're not fixing the issue at the root cause, then the medications stop working. And that is why so many people, even people here who are watching this, end up on two, three, four medications and then insulin. Okay. Some people go straight to insulin because their numbers are so uncontrolled. In the hospital today, I can count three people who I saw who were directly impacted by type 2 diabetes. One was experiencing, vision loss, blind in the left eye, right eye is going constantly at the eye doctor, getting injections into the eye in an effort to save his vision. So that was one person. A second person, unfortunately, tied to an IV bag because of severe infected wounds on the legs. And then that third person who is directly impacted was directly impacted by a stroke, luckily, a mini stroke. So when I say mini stroke, it means that it's a very mild symptoms that resolve quickly. It's a warning sign. And so that was a wake up call for that person as well, as to just how extensive type 2 and how far reaching type 2 diabetes is to the body. So that's just three people. The next time I'm in the hospital, I will see more. It's every day. Every day, there are people coming through the hospital who are having devastating symptoms. So, I want to encourage you all to take action, to know that it can be done with the right guidance. It can be done. Now, one of the things I wanted to focus on tonight are what are some of the steps that you can take to successfully reverse type 2 diabetes. And so the first one, obviously, nutrition. Nutrition is everything. And the approach that I take with the unique system that I've formulated, the approach that I take is food is medicine. And so many times, people who come to me, they're consulting with me, they've signed up with me, they come to me, and their first desire is, I want to be off of medications. I want to avoid being on medications. And so we do have to come to that understanding that if we're going to treat, if you want that goal, right? Ultimately, you don't want to be tied to medications. You don't want to end up on multiple medications, right? If that is your goal, then you must treat your food as medicine. And if you're going to treat food as medicine, then you have to dose your food, right? And you have to dose your food in a way that is very much focused on blood sugar control. So that is the first thing. So food is medicine. That is the motto that we have. And we have to learn how to dose our food. Dosing the food is like dosing medication, right? How many of us have given our kids Tylenol, and on the label it says, if you have a 10 kilogram child, or they give you the weight, and then you are supposed to decide how much Tylenol to pour into that little cap based on their weight or based on their age. It is the same thing when it comes to food. And that is why so many people are stuck, because you're stuck, looking on Google, you're stuck trying to find information through social media, through YouTube. You're getting bits and pieces, and you're not getting information that's very much targeted to you, geared to you, tailored to you. So that is the number one issue that I see. Many people, when they start with me, they're intermittent fasting. And I can tell you right away, the problem there, you get into trouble there, is because your food is not dosed appropriately. You're not getting what you need from your food. If you're intermittent fasting, you don't get what you need. So fasting is not necessarily the wrong way to go. However, if you're doing it completely on your own without the right guidance, then fasting can get you into trouble. The next thing that I see is, for example, applying things that might be considered healthy for the average person, applying it to yourself. So, drinking smoothies, juicing, those are also areas that can become very problematic. Again, because you have to know how to dose your food appropriately. And many people are actually putting the wrong things into their shakes, juicing the wrong things. And actually, juicing is not necessarily recommended, to be honest. So, for someone who has type 2 diabetes. So, obviously, dosing your food is something that you still need to that guidance, right? So, it's impossible for me to tell you exactly how to dose your food here. Why? Is because I need to know your age, your weight. I need to know what your daily habits are. I need to know, what are your blood sugars running? I need to know, I need to know that information to understand exactly how to dose your food. So that is the number one mistake that I see, is assuming that just eating healthy in general is going to get you the results that you want. And the reality is, it is not. It does take a whole lot more expertise, a whole lot more learning and effort in order to get your numbers right. So that is the first thing that I see. Now, one of the things I always say is, obviously the things that you should be cutting out of your diet are refined carbohydrates. That needs to go. Refined carbohydrates are things like white bread, white rice. There is just no nutrients there. There is nothing. If you could name a benefit, there is no benefit, right? There's no fiber in it. It's just starch that becomes glucose. So foods that are going to break down right away into glucose, the minute you put it in your mouth, it starts to break down into glucose. Those are the foods you want to cut out. So that includes rice, that includes white rice, white bread, juice, soda. Those are the things you want to eliminate. And to be honest, most of the women who I work with, when they start with me, they have taken those steps already. They don't add sugar to their food. Most of them don't even have sugar stocked in the house. So most people have actually taken those common sense steps and are still very frustrated because they take those steps and the numbers don't get better. And the reason is, again, you are trying to do something that takes a whole lot more expertise on your own. And so that is why it is important to understand exactly how to dose your food appropriately. So that's the first thing. The second thing is moving your body. And this is something that I say over and over. I'm going to sound like a broken record. You have to move your body in two different ways. You should be walking, which is low hanging fruit. Walking is easy. It's easier on your joints typically. It's low intensity and it's very effective. So you should be making it a habit to walk throughout the day, walk after meals, 15 minutes after meals, take breaks at work to walk. Walking is really important because again, it will help to drive those blood sugars down. It will help with weight loss. But the other side of movement comes strength training. That is critical. Strength training means building muscle, putting muscle on your frame. So that is also another important aspect that many people, especially women who are over the age of 40, are missing. It's that piece of the puzzle that a lot of women are missing. Strength training is about building muscle, and that is where a lot of your energy should be focused. Do you have to spend 2 hours in the gym? No. Are you aiming to become a bodybuilder? No. Are you aiming to drop 20 or 30 pounds in a month? Absolutely not. Absolutely not. Actually, that is a huge mistake. If you're dropping 20, 30 pounds in the span of a month, 2 months, then you might find that that journey itself leaves you with very little energy. You don't feel well. Your cravings are through the roof. You're basically on a crash diet. So it's really important to understand how to balance moving your body with also maintaining your energy, moving in such a way that you gain energy and you don't lose energy along the way. And so a lot of people in an effort, we hear typically you have diabetes or you have pre-diabetes, lose some weight, move more, eat less, lose weight. That's the advice that you get from your doctor. And then they say, then come back in 3 months or 6 months, we'll recheck the numbers. And then you're on a deadline, right? If you didn't want to start medications, they say, if the numbers don't get any better in 3 months, we're starting a medication. So now the pressure is on. But you are left, with very little idea about what to do next. Nutrition, you're not sure what to do next because you've cut sugar out already. And movement, well, now you're going hard, right? Now you're in the gym every morning. You're in the gym for an hour, hour and a half. You're on that treadmill. You are going hard, okay? And that is where the burnout happens. That is where, eventually that's unsustainable. And that is where you put the weight back on very quickly because it's just, an uncomfortable process and it should not be uncomfortable. Reversing type 2 diabetes, getting your A1C down, getting your blood sugars down should not feel uncomfortable. Okay. So that is the main thing. If you are feeling more cravings, if you are just counting the days until you can eat whatever you want, it means you're on a crash diet and it means you're on a unsustainable path. And those are your warning signs, that you need that additional guidance, you need that expert help. The reason that you feel so alone when you walk out of your doctor's office after you get that diagnosis is that you don't get that guidance, you don't know what to do, and you try the most common sense things and it still doesn't work. So those are just a couple things Habits are also an important aspect as well. You'd be surprised how habits also affect blood sugars. Now, a question that I always get is type 2 diabetes stress related? And the answer is, well, it's a stress is not the sole cause of type 2 diabetes, but it's definitely a contributor to high blood sugars. And the reason is when our bodies are physically stressed and when we're emotionally stressed, then our bodies release these stress hormones. The most popular one, or the one that many people might know about, is cortisol, and it causes our insulin levels to spike. It causes our blood sugar levels to spike, and it basically causes a lot of chaos in our body, especially when we are stressed for the long term. And so, something that I see very commonly with the women who I work with, when they're coming into me, they're incredibly stressed. And some of them don't even realize it. They're balancing home, they're balancing work, they're balancing, so many different things, busy schedules. And because of that, their body is incredibly stressed. They're not getting enough sleep. They're always, high strung. They're always moody. Yeah, so they're under this incredible amount of stress, and this stress has been going on for so long that they don't realize it. They've learned to live in this very wound up state. And it really takes someone on the outside pointing out that you must take the time to understand what your body is experiencing and to understand how to cater to your body. And it's amazing that once they're aware of how much stress affects the body, and they take those steps to reduce stress, they take those steps to push back on the stress, to counteract the stress, then typically the blood sugars follow as well. So stress is actually, it's actually pretty sad to see, because it's actually one of the biggest drivers of type 2 diabetes, to be honest. The reason I say it's a driver is because over years and years, we're busy working, we're trying to, carry the whole household on our shoulders. And what happens is a lot of self neglect happens along the way. We're not paying attention to ourselves. So the women I work with, a lot of the times, we will be going through what needs to be done. And the first thing I'll identify is that they put themselves on the very bottom of the to do list. When we say we need to do this and that, we need to, make sure your strength training, we need to make sure, your meals are looking a certain way. How are you planning your meals? What did you make? Why did you eat that? It really does boil down to a time issue, not taking that time for themselves because they're so busy putting everything else first. So that is a huge part of the problem. So if tonight you are one of those women who, you are just going, 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 you're the energizer buddy. The only thing is you're missing the energy part. That you feel like you're just going on adrenaline, right? You're just pushing yourself through exhaustion, through stress, through frustration. You're just pushing through a hectic schedule, through all the demands at home, through extracurricular activities, through church responsibilities. You are pushing through all the things that you have to do. If you are one of those women, I say take a moment to audit. What did your day look like? And were there times during the day that you took time for yourself? Did you take that walk after lunch, or did you scarf lunch down quickly and jump right back into work? In the span of 10 minutes, you scarf lunch down and now you're back to work. Did you take your full hour long or 30-minute break at work? Because that is one of the things that is necessary to, again, counteract type 2 diabetes. And these are the things that most people are not aware of, and they continue in this state until the disease itself makes it impossible for them to continue. And usually when that happens, we're talking about devastating complications. We're talking about when someone is now forced to take time, downtime. It is because of a stroke. It is because of neuropathy. It's because of amputation. It's because they were in the hospital for complications. It's because of being on dialysis. Now you have to take, 12 hours a week, 20 hours a week, whatever it is, to be connected to a machine that does the work of your kidneys. Some of you might understand what I'm talking about because you've watched family go through that. So you have a clear understanding of what your future can look like if you don't take a moment for yourself. For those of you who are not having symptoms, you might be experiencing some fatigue. You're looking at high blood sugars, but you're not really feeling the damage. Just know the damage is happening. So it is important to take time out for yourself. And again, it's a very sad thing to see because I see it so often that women who are struggling with type 2 diabetes are also women who are putting everybody else before themselves. They're putting everything and everyone before themselves. They're working hard. They're achieving, they are making achievements. They are getting it done. But when it boils down to themselves, they're not getting it done. And so, again, it's really important to take that time out, invest the time, invest the money, invest what it takes to turn these numbers back so you can understand what quality of life looks like. So with that, that is, just take the steps that I talked about. Understanding nutrition is critical. Dosing your food like medicine is also important. Movement is critical. So if you are not moving your body, I say start with walking. Start taking breaks after every meal. Take a 10-minute break. If you get to work 15 minutes early, take a walk, a couple laps around the parking lot. Move your body. Make a conscious effort to move your body. If you have not cut out refined carbohydrates, remember, refined carbohydrates, the minute it touches your mouth, it's starting to break down into glucose. So you want to make sure that you cut out the easy things, right? A lot of people, I know you've done that already. Again, if you've done that already and those blood sugars aren't budging, that is where you need the additional help. So with that, I am going to close off, but I want to encourage you to take action. If you've been sitting in anxiety, watching your blood sugar stay high, then action should be your next step. Otherwise, your body is eventually going to force you to take downtime, and it could be the wrong downtime. As obviously I'm here. I have a dedicated practice to helping everyone, but especially women just like me, reverse type 2 diabetes naturally. And so there is opportunity to book a free 15-minute discovery call if you are ready and serious inquiries only. If you are still in this place where you are not ready to take action, then it's all about action. That's what I say. So if you are ready to take action and you want to know more about what we do, then there is the opportunity for a free 15-minute discovery call. You can also click the link where in my bio or in my profile. It's the Linktree link, and there you will see so many other options so that you can get to know what we do and see if it's right for you. So with that, I'm going to close off. But as usual, I always welcome questions. Always welcome topics suggestions. So if you want, you can go ahead and put that in the comments, and I can talk about anything you want to talk about down the line. All right, with that, have a good night, guys.